with a very special guest, Dr. Mulugeta Gabriel. Welcome, Dr. Mulugeta.
Yeah, good afternoon, Hadash. Thank you for having me.
Of course, we're so honored to have you. You have been very active in our community and have been doing so much throughout this war. So honored to have you here, Dr. Mulugeta.
Yeah, so I am also so happy to be here at with Aksumawian Media Network, and I am glad that we met here again. You told me earlier that we actually met on Clubhouse and
Yes.
other platforms. So good to see you, Hadash.
You too. Yeah, it was nice seeing you on Clubhouse, and I'm glad to be hosting this today. For our audiences, please share this Facebook Live and then the link on YouTube as well. And we will be starting right now. Could you please, I know everybody in our community knows you, but I would like for you, to introduce yourself and tell us a little bit more for those that maybe don't know you.
Yeah, as you said it rightly, I think I have appeared in several media and in
Definitely.
community affairs that people know me by now.
Mm-hmm.
But yeah, for anyone who is watching this, to be my name is Mulugeta Xavier. By profession, I have doctoral degree in biostatistics, which is in the public health field. And currently, I am vice chair for academic programs at the Medical University of South Carolina. And I am also involved in a lot of Tigrayan, community affairs, whether it is Tigrayan community in the Carolina, security for justice, and education, engaging diaspora for education and research through partnership, which is EdRip. So, in my field, I do a lot of research related to chronic conditions, capacity development, especially when it comes to Tigray in translational research. That means taking research from the bedside to the population side. So I am very familiar with the what has been going on in Tigray over the last many years. As you know, I was born and raised in Tigray. Um, so my roots are from there, and also I was educated all the way to actually college in Ethiopia. So I am also familiar with the landscape in Ethiopia. And through my education, after I got my PhD here in the United States, I have been to Ethiopia several times. Sometimes once a year, sometimes twice a year, for things related to academic development, research development, partnership with the universities. So yeah, to sum it up, I am involved both in academics, in administration, academic administration, as
Yeah,
well as humanitarian work.
it's so impressive. You're an amazing. That's why I'm so happy to have you here too. You said it yourself. You're in literally everything, and you have been doing so much. Not only when the war started, but even before. As you mentioned, working with universities and Ethiopia, Tigray as well. So it's amazing. So thank you so much, for your introduction. You're also, I know you're very active here as well. I would like to, mention to everyone that he said he does work with SJTE, and he was very active in the campaigns that we've had in Clubhouse, like the World, We Are the World campaign, and then Tigray Can't Wait as well. I was an audience there, and I was able to see you do so much. So it's amazing.
Wow, I am glad that you have been to those two actually, which I call really, really events that I would put in my CV. You know what it means, right?
They deserve to be on the CV.
So I told everyone who helped us on the We Are the World, which was really what I call killing two birds with one stone,
Yeah.
as well as the Tigray Can't Wait. Both of them were really, really great opportunities. And everyone who helped us, we told them, I think this is so important, work that you should put it on your CV. So I had it on my CV.
Yeah.
Those who participated and helped should put it. And maybe Hadash on the second Tigray Can't Wait event coming up in March. You will
Is
be
this my invitation?
from home. You are
I
invited.
would I would love to. Everyone working on that was just so amazing, and I was so happy to just be in the audience and listen to everything. So I would love to join you guys one day and help in any way possible. But yes, so honored to have you. And I'm just going to jump right into the question. Dr. Mulugeta, can you please describe the pre-war status of the healthcare system in Tigray for our audience here?
Yeah, so Hadash, we wouldn't be speaking about humanitarian crisis in Tigray if it was not for the war that began. Well, I call it the episode of this fighting. It started November 4th, 2020, but the war actually stayed a little bit longer. It was 3-4 years before that. So it was just really because of this reason that there is a humanitarian crisis, a health crisis in our home state, Tigray. So, really the war began November 4th, 2020. After the war began, several things happened. I mean, to summarize it or to just use a key term here, broadly a humanitarian crisis of catastrophic level has happened, right? But then we can actually then also look at what was the pre-war status of things in Tigray and what is happening post-war, as we discuss in this program. So maybe if the technician could allow me to do uh, or share the slides that we have, that would be helpful here. So to start with some background. The Tigray region, which is the northern region in Ethiopia, had health system that was, really based on a foundation characterized by really three important things. It was really a health system that is enhanced by community engagement. As we will see, almost 70% of health facilities were built by the community. So that is one important characterization or characteristic of the Tigray health system. It had its own early warning, alert, and response system. That means it was really growing to become almost a health system that you can find in a second world country, not just a first world country or a third world country. I mean, it was growing. I mean, like if we will see later, in a minute, that the health infrastructure was really growing very, very well. That I was so hopeful we will probably reach, second world country states in terms of health infrastructure. Now, to come to really some of the details, Tigray pre-war had 1,007 fully functioning health facilities.
Wow.
40 of them are hospitals, 226 of them are health centers, 741 are health posts. So you can imagine that this, if you go back 30 years from 2018, you will never see these numbers. Okay, so these are actually numbers or health facilities that were built through the community, the Tigray government, in almost nearly to 3 decades, right?
Yeah.
And because of this, Tigray has also had really a pretty healthy health coverage, about 95%. This is something you expect in second world countries. And there were about 30 million visits per year in those situations. And you can see the other huge thing that have happened over those years is we were able, Tigray was able to develop to train its own health workers, 22,000 of them, at least.
It's impressive.
Yes, I mean, these are amazing numbers. You can see,
Amazing.
Hadash, yeah. And then it also introduced, Tigray introduced this health extension workers program. You have probably have heard it. These are community health workers
Mhm.
who live in a small community. They live there, they are trained there, and they stay there. So they are helping with hygiene, they are helping with small first aid emergencies and things like that, connecting the patient with that next health facility, whether it's a health post, a clinic, or a hospital. So, Tigray is a birthplace for CIS, actually. It is known to be a birthplace of health extension workers or community health workers. And it also introduced like an insurance program. You are familiar with health insurance here.
Of
This
course.
insurance was almost $50 a year,
Mhm.
and people were using this. So all in all, pre-war, really, Tigray, to me, was making headways towards joining middle income level health infrastructure and health system. Well, as we will see quickly, I think that doesn't that's not true now,
Of
and
course.
that's why we are talking about a humanitarian crisis of this.
Yeah, yeah, and looking over these numbers, even for myself, I have never really truly looked at the numbers. So to see 90% of the population was, how the health of the 90% of the population was covered. It's a that's a lot of people, and I don't think we even knew that. So that's it's just
Yeah.
looking at these numbers. I'm surprised myself. It's yeah,
Yeah,
today.
and these numbers, to some people, even you are admitting here that you didn't know. There are a lot of people who don't know about this. I
Yeah.
mean, we have been making tremendous progress, and even these are like we are talking about the infrastructure, right? Even if you look at the health outcomes, so
Mhm.
health outcomes primarily are measured by some key indicators. For instance, mortality under 5 years old, and then you could also look at mortality in the mothers who
Mhm.
give birth, right?
Mhm.
Those were almost like middle country type numbers that we have had before the war.
Mhm.
So it's not only the infrastructure, but also the health outcomes. The indicators for health outcomes were pretty good.
They really were. As you know, you said it says for maternal mortality, it's 106 out of 100, over 100,000. So that's a really good number, and we really were doing amazing, and our health outcome was pretty great as well. And now it's time to talk about the post-war. For everyone, for our audiences, you have seen the numbers, and our Dr. Mulugeta has explained more. And then now we're just going to talk about what this war has done to Tigray and the healthcare system, because it truly demolished and you guys will see right now. He will go more thoroughly into that. But please describe to us what has happened to our healthcare system now and what the post-war numbers look like.
Yeah, yeah. So Hadash, like you said, the reason today we are talking about humanitarian crisis, the health crisis of this war,
Mhm.
is because November 4 completely changed the landscape of humanitarianism. The health infrastructure, the health system in Tigray. It completely changed it. What happened is, there was war, and it's not just as a consequence of the war that this health system collapsed totally,
Mhm.
but there was a deliberate attempt
Mhm.
to destroy the whole health infrastructure in Tigray.
Yeah.
So really, if you look at the news headlines, I was just looking at today.
Mhm.
What is the world saying today about Tigray?
Mhm.
Uh, and we will compare it to pre-war.
Mhm.
Doctors are begging. Can you imagine? I told you, Tigray trained 22,000 health workers.
Mhm.
Among this are doctors, nurses, all types of health workers.
Mhm.
The top cream of this health workers profile are the doctors. There are doctors begging. This is in AP News.
Mhm.
This is in BBC.
Yeah.
And then today, also the United Nations World Food Program reported that 40% Tigrayans are under extreme lack of food. I mean, they are using actually a code name here, a code phrase that's less sensitive. Extreme lack of food is famine.
Mhm.
They don't want to call it like the genocide. They don't want to call
They
it
don't want to. Yeah, they don't want to
extreme.
label it.
Yeah, but you can see this is today's news. We're talking about today.
Yeah.
I told you the pre-war situation was so rosy, so amazing,
Yeah.
and the opportunity cost. The last 4 years.
Hmm.
Imagine where we could have been, right?
Right.
But now we are at this state. And then, I mean, even a few months back, a few weeks back, what we have seen from reports of the Doctors Without Borders,
Hmm.
the hospital that you see over there that
Hmm.
has, some of the bed, some of, the specialized rooms destroyed. You
Hmm.
can see, this picture is not from 1984. You would think people would say this is the way of the world picture. No,
Right.
this is a picture from now. So Ethiopia is deliberately starving the citizens, its citizens in Tigray. One,
Yeah.
Ethiopia is deliberately destroying the health system in Tigray.
Hmm.
So there is really this catastrophe that is going on,
Hmm.
that is really very sad. To add to this, I told you earlier, it's not only the health infrastructure, right? The health indicators, the health outcomes were so healthy.
Yeah.
We're progressing to join the middle income countries that now post war, women and child health, if you see it, 1.6 million children who are under 5, and some of the pregnant and lactating women, they are in need of nutrition intervention. That means they are under acute malnutrition.
Yes.
You only need nutrition intervention or treatment if you are beyond hungry, right? It's not just the hunger, but
Hmm.
there is an acute malnutrition. It's a disease,
Hmm.
pretty much. And that rate among the women is about 60%. Can you imagine? 60% of women who are breastfeeding, who are lactating, who are pregnant are under this situation. And acute malnutrition in children under 5 has hit now 29.1%. Earlier we were talking about, how much we have achieved to
Hmm.
reduce all this, determinantal
Hmm.
factors
Hmm.
affecting our population.
Hmm.
But here, we have not only come to zero, but it even now become very, very bad, really catastrophic almost. And we have data that clearly shows um, more in-depth analysis of what is going on, and that will come out actually in a journal that
Hmm.
will be published next week in the Lancet Global Health.
Wow. Just the numbers to see that is even honestly mentally exhausting just to look at that. But before we go more, thoroughly into that, I do want to emphasize what you said. It is deliberately being done by the Ethiopian government, and that's something that the international community needs to like say out loud and say it and actually tell the world it is a famine and put a stop to this. So I would like to emphasize that it is deliberately being done by the Ethiopian government, and it is the blockade is being done by the Ethiopian air forces and Eritrean forces, and also the Amhara Fano. So it's the Amhara militia Fano. I think that's really important as well for everybody to understand. This blockade is happening because of so many different things, and it's something that can be stopped, and the blockade can be put to an end. So, just wanted
Yeah.
to emphasize that, and if you would like to add more, please.
Yeah. So definitely. So the terms that are being used, in the literature. So I have been studying actually, the humanitarian and health crisis of war
Mhm.
since this war began. And so what has transpired around the world is, governments, especially, those who are fighting against their own people.
Mhm.
These are repressive governments, creating wars within their own communities, within their own citizens.
Mhm.
Some of the tactics they use is what we call weaponization of healthcare, which has happened in Tigray. So you destroy the healthcare in such a way that people, end up in, the deathbed, right? And the other one is what we call weaponization of food.
Mhm.
I mean, how can a government starve its own citizens deliberately. And you have seen that news, like the headlines, in in the AP news, in the AFP news. The government of Tigray, the government of Ethiopia, is starving its own citizens who live in Tigray, and that has happened.
Mhm.
Now, even I think if we go further to see what has transpired beyond the news headlines, that means, in order to really put good ground with regard to especially knowledge and information on this topic, because this is not an easy topic, right? We are talking about grave size crimes against
It's humanity.
humanity that are being done on my people, on your people, right?
Yeah.
On my family, on your family. This is not even like far away. We are not detached from it. We are suffering from it, right? So what we have done is we have tried to kind of
Mhm.
document this, and put it in journals.
Mhm.
So I will try to share some of what we have done to educate the scientific community, the health professionals,
Mhm.
the public health professionals, in such a way that they have some understanding of what is going on as a result of the war imposed by the Ethiopian, the Eritrean government in their allies in the Amhara region, which you call the Fano militia. And you have also, I mean, other allies that are helping with this, whether they are bombing, they are
Yes. Great.
providing
Yes.
artillery, providing drones, they are providing other ammunitions that are being used to destroy hospitals, that are being used to destroy civilian infrastructure and in Tigray. So if you could give me the slides back, I would like to show you a couple of items that we have published to show the scientific community
Mhm.
what is going on in Tigray. So here is the first one. I
Mhm.
mean, as you know, the Lancet is the top medical journal in the world. Okay, so in this case, the doctors at IDER made an appeal to the world, to show what is going on, in particular at IDER Hospital, which is, the one of the best hospitals, tertiary hospitals that we have in Tigray.
Yes.
Of course, one of the two that we have. One is in Aksum, by the way.
Yeah. Yes. Of course.
So what has happened is, friends of Tigray who live in Israel, these are professors, academicians,
Mhm.
started this campaign to write a letter on behalf of the doctors in Aider, and we joined hands with them.
Mhm.
And this letter came out. I am a signatory, and a lot of my colleagues at my university, as well as other Tigrayan professionals, have signed on to this. I think we are about 39 of us,
Mhm.
and in this document, what you see is it is showing what is going on, the gravity of the problem, even in one hospital, in one specialized hospital.
Okay.
The other one is, one of my collaborators, actually, who was involved with me in two projects. Her name is Dr. Marhawi Tasbaha.
Mhm.
He is a doctor who treats diabetic patients at IDER,
Mhm.
and she wrote a letter, and one of her mentors, Professor Solomon
Mhm.
from the UK, was able to connect it with the International Diabetic Foundation, and the International Diabetic Foundation released a statement, and that statement was out in the journal called BMJ, and we are also signatories. A few of us are signatories in this letter. So
Mhm.
these two were very, very instrumental in kind of telling the world
Mhm.
about what is going on, even in a limited scale
Mhm.
within one hospital. And the
Mhm.
gravity is, you will see in those slides that show that, one, they have run out of oral medications for diabetic patients. Can you imagine? You can only control if you have diabetes. I happen to study actually diabetes
Mhm.
as part of my research at the university for the last maybe 12, 13 years.
Oh wow.
This team of
Mhm.
experts who study diabetes.
Mhm.
So you can only have control of your diabetes through lifestyle, through
Mhm.
medications, or through insulin, right? Those
Mhm.
are your options. Now, somebody who cannot control their diabetes using lifestyle options would go to oral medications and then would go to insulin. In
Mhm.
the case of either, well, they don't have this option now because there are no oral medications for diabetic patients. And during that time, this is a new year, by the way, so now it's almost a month.
Yeah.
There were only 150 vials of insulin left. So all these people are really, waiting probably for they are dead unless somebody intervenes and helps them. So, and the worst, what makes this really painful, Hadash, is all these medications that could treat these patients are held up in Addis Ababa.
Yeah.
The government in Addis Ababa is holding up medication that was supposed to cure, to help these patients that we are talking about. In Tigray. So all in all, when I try to summarize this, I use this chart. Okay, what is happening is, people are going to be injured somehow, whether it is rape or some other type of injury. Okay, maybe it's a sharpnel from a war effect, maybe a bullet from a war effect,
Mhm.
and they are also starving on top of that. There are other illnesses. You could have a flu, you could have a cough, you could have COVID, and you have also pre-existing conditions like diabetes, cancer, HIV.
Mhm.
You have all this. Now if you don't treat them, what is going to happen? There is going to be severe illness
Yeah.
and disability and more suffering, right?
Yeah.
Well, actually, and then you give it some more time, and this thing, no intervention, no medical help, no intervention,
Mhm.
no humanitarian help.
Mhm.
What is going to happen? These people are going to die.
Yeah, and that's exactly what's happening right
And
now.
that is exactly, that's what's happening, and that is the reality. And the reason I use this type of charts is it's much easier to show people that you know we are at a stage where a lot of people are dying because we are talking about 400, almost 60 days, right,
Yeah.
since the war began. And
Mhm.
this is a lot of days for somebody who has diabetes, for somebody who has HIV, for somebody who has cancer, and they don't have any help along this way. So yeah, this health crisis, this humanitarian crisis is so painful that the world needs to pay attention to solve it.
Yeah, and I think what's so painful for us as a diaspora, just looking as this is preventable, like you said. We have the medical supplies ready, everything is ready, and it's being held by the Ethiopian government. So I think that's such like an important like emphasis is the frustration of our community comes from the fact that this really is preventable. But yeah, thank you so much for going over that. That is, it's just a lot, and I know it's probably hard for our audience, especially Tigrayans, to look at these numbers and to see that all this is we could could be prevented, but now we're forced to see our families go through this and watch our families die. Like that's truly what it is, and it's so painful, but that's really what's going on the ground. But yeah, thank you so much for going over that, Doctor. And could you please speak about what the international community can do? Because like you did work on articles, and I'm sure that's the intention is to get the international communities to to look and actually see what's going on and pay attention to the articles that you have been writing as well with others that are involved. So could you tell us a little bit more on the international community, if they're really like what are they doing? Like what it's so frustrating, but it's just like what are they doing, and are they even looking at the articles, and like it's just like from your view, like what is it that they can't say it's a genocide and there's famine going on, so then we can actually move to helping the people on the ground.
Well, yeah. So, Haddad, this is a good point, a good question. So, this is where what we call governments have national interests, right? So they are going to focus on that. And then you have also multilateral organizations like the United Nations, which has the WHO, the World Health Organization. You have the WFP, the World Food Program, which are UN agencies, right? So and then in between are professionals like health professionals, right? Public health professionals and other professionals in the middle. Some of them work in those organizations, in those institutions. Some of them work in government entities or offices. So what we are trying to do through these publications is to reach out to all of them, because mostly what happens is, unless you provide evidence that is peer reviewed. So peer reviewed means, experts look at the data, and once they look at the data, what they do is, uh, they accept it or reject it, right?
Yeah.
So those are some of the publications that we have seen, top medical journals. Okay, so we are trying to bring in some of that data that is being collected in Tigray, and we are analyzing it, and we are writing the report and submitting it to journals. So you will see in the next few weeks and months a lot of the work that we have been doing so far coming out in the scientific journals, and they are going to bring a lot of effect, I tell you, because even the letters that I was telling you earlier, the International Diabetes Federation, the Lancet paper, all this have attracted the attention of the media. They have attracted the attention of policymakers. So you're right, governments are not acting in the way we would like them to act because of political and geopolitical situations that they have. But I think essentially we shouldn't be stopping from educating, especially the professionals who have a role to influence the organizations, the policymakers, and the government. So the role of people like me is, and the really the reason we are doing this also in English is to reach out to this type of people, right? Now
Yes.
these are going to be important, but yeah. So some of the advocacy work we are doing around this, in addition to the publications, is, well, to organize conferences, to appear in international media,
Yeah.
to tell them the stories
Yeah.
based on evidence, based on data. So those are going to help us, I think, for the governments and the multilateral organizations like the UN to come to say, instead of like dancing around this, there is catastrophe, we are heavily concerned, extremely concerned, to actually name the
Yes.
name, to call the thing by its name, like it's
All by what
genocide.
it is. Yes.
Exactly, genocide, for instance,
Yeah.
like famine. So I think they are pretty close to talking about famine, because this 40% that just came out by the UN WFP, which is the World Food Program,
Yeah.
I think that's going to bring a lot of attention and pressure to the United Nations to go to classify about what is going on in Tigray. It is a full-scale famine, and I think that's going to happen, I believe. Um, on the genocide thing, I think it's a political and diplomatic decision. I think the US is pretty close to doing it, but for diplomatic and political reasons, they are withholding their judgment. So it's not really lack of not knowing, because we are actually doing all our best to make them aware of what is going on. But there are some political decisions that are preventing them from moving in that direction.
Yes, thank you so much, Doctor, for going over that thoroughly. And I'm sure you've answered any questions our audiences probably have had about the international community and their intentions as well. So thank you so much for discussing that thoroughly. And then also, I just wanted to give you a chance, to finalize what you have been doing as well, because the articles you've been writing, I know with others with you as well. Um, there, there's a lot of them, and as you said, they will be published pretty soon. So I just wanted to give you a chance to tell us where it is at now, and then also how it has been for you while working on those articles.
Yeah, well, I think I like this question, Hadash, because it brings me to what I do. So I am trained to look into data and actually develop methods of data collection, data synthesis, and data analysis, and then inferring from those analyzed data to come up with some conclusions. Right, that is what I call evidence. So when you talk to policymakers at any level, that's what they are looking for. So what we have done really over the past several months is there is full blockade and blackout, right? Despite that, we find ways to collect data that is really so helpful to bring light to what is going on in Tigray, especially destruction of health facilities, and then also and recently the acute malnutrition that is going on. So, with regard to the destruction of health facilities, we have documented. Actually, I just showed you the 1,007 health facilities. I have data that shows where each one of them is. Like, I have the geo-coded data that tells you where they are. And then also their status. Are they fully functional? Are they partially functional? Are they not functional at all? Are they not, no communication with their facility because of occupation by the Eritrean forces or by the Amhara militia Fano? So we have this classification uh, for each health facility. I mean that takes a lot of work.
Sure it does, yeah.
You have, by the way, with that type of data, you cannot just report it because you got it from one source. The scrutiny is so heavy, so tough that you have to triangulate it from several sources. So despite the blackout and the blockade, we managed to actually do that. So some of the publications that we have done, this is with a team, several members to it, all of us Tigrayans, and the lead author is in Australia. He is a postdoctoral researcher, Dr. Hailai. So what we did in this study is sort of look at assessment of what has happened in Tigray over the last. I think the time was from almost November all the way to June. But we have done more studies, like I told you. That one is already published in the BMJ Global Health, and this second one is coming up next week. This is about malnutrition. Professor Mulugeta, by the way, is a professor of public health and nutrition at either hospital, Malala University. Okay,
Oh, wow.
we were able to somehow connect and do this analysis, and this formative work, which will really shock the world, is coming up next week. And these pictures you can see are indicators of what we have found in the malnutrition study that I showed you. I mean, acute malnutrition, Hadash, it is one of the most abusive ways to kill a person. I mean, a child. Can you imagine? A child can die probably from so many things, but to think that there is a government that is committing this type of crime against that type of child by starving them to death, you can imagine. It's not like where a bullet comes and kills you. That is okay, almost.
Yeah.
This is a slow, motion, painful death that they are subscribing to those babies, and these babies are dying. You can imagine, like myself and you, who could have become productive members of not only the Tigray community, not only the Ethiopian society or the African society, the world community. That's where we are contributing right now, right? The world community. And we grew up, in the small towns and villages of Tigray.
Mhm.
But we are here, we are now here because we didn't die from this type of starvation and malnutrition. So it just pains me when I see these pictures. I mean, it's very emotional
Mhm.
picture. And you can imagine when I am looking at the data, how much emotional attachment I could have
Yeah.
to each data point, because I know that each data point is actually a person, a human being. That is, you have this cruel government
Yeah.
that wants to kill
Mhm.
such type of babies.
Mhm.
So I think in general, what we have tried to demonstrate through our studies
Mhm.
is that, I mean, this is very systematic. A government cannot, uh, a war. I mean, a war cannot just destroy more than 80% of your health facilities, right?
Right.
Unless somebody is fine, looking for hospitals,
Mhm.
looking for health posts, looking for clinics, go there and burn them down to the ground. That is what's happening. It's very systematic.
Definitely is.
Killing of health workers, killing of humanitarian aid workers.
Mhm.
These are deliberate. They don't want them to help. So
Mhm.
you get injured from something, right? Your next option is some health worker helping you,
Yeah.
but these health workers are displaced. Some of them are killed. So where are you going to go? So the systematic nature
Yeah.
of this is so gruesome.
It
And
is.
then you have the intent to inflict sustainable harm. Okay, the word sustainable is important here.
Mhm.
It's not only that they want us to die today, you know to die only tomorrow.
Mhm.
They don't want us to exist. That's why these babies are being killed systematically. This malnutrition, this acute malnutrition, deliberate starvation,
Mhm.
is to kill as many babies as possible beyond the threshold in such a way that there is no way the Tigrayan, uh, um, Tigrayans don't survive,
Yeah.
or don't live,
Yeah.
don't stay to live in their motherland. So,
Yeah.
by
And that is like that,
demonstrating
sorry,
this
not to
too.
interrupt, but not to
Yeah,
interrupt you, but that what you said is definitely like it truly is the definition of genocide. Like that's what it is.
it is
That's
exactly.
what you
Yeah,
described.
yeah, and that is exactly so when you tie these two, that's why, you were earlier telling me, why don't they call it a genocide, right? Why don't they call it famine?
Hmm.
And I mean, these are things that are clearly need to be called, famine and genocide,
Hmm.
without much qualm, because there is sufficient beyond threshold evidence to say so. So I think it is important that we continue to work this advocacy
Yes.
work along the way.
Yes.
And what part of this is, I was telling you earlier,
Hmm.
you cannot just stop publishing it. You have to do more.
Hmm.
Even in any scientific work that I do or we do,
Hmm.
you do your work, you publish it, and the next step is, well, you make people know about it. So
Yeah.
you organize conferences, you organize symposiums.
Hmm.
So now this is the second symposium that I am organizing actually on this topic,
Yeah.
an international symposium.
Hmm.
And as you can see, the flyer, beautiful flyer, right?
Amazing. Amazing.
Yeah, so February 4th, it's a full day symposium.
Okay.
This is happening. We have 12 speakers from around the world.
Okay.
And it's not only about Tigray, like I told you. In order to make a full case about the impact of war on
Hmm.
humans broadly, we have to cover wars also around the world: Syria, Yemen, West Africa, the Middle East. These are going to be discussed. This is during this full day global symposium, and there
Yes.
are, we will be presenting our data about Tigray as
Hmm.
part of this. That's why you have Tigray in the middle of this as part of this event.
Yes.
And it's hard to miss Tigray now, because every media talks about the current war in Tigray,
Mhm.
and, the name Tigray, and and its symbols, right?
Yeah.
Whether me and you, the Tagaro, the Tigrayans,
Mhm.
or even the other symbols that we have
Mhm.
become now very clear around the world as to who we are, as well as to what's happening to these people
Mhm.
in Tigray. So this is going to be very important event next week.
Yes.
Uh,
Actually, if our audiences can, take a screenshot of that and attend, because this is amazing, and the fact that I think your your favorite saying is two birds with one stone. So advocating for Tigray, and also also advocating for everyone else as well, and learning about what's going on in the world, but really. Speaking about the famine in Tigray, and making sure the world hears us, because it is the numbers show it themselves. It's really, like, it's really bad. So everybody go to the Zoom event, and please join Dr. Mogeta and everybody else. But yeah, thank you so much for telling us about that, and we'll definitely be there, and for speaking with us about the humanitarian crisis going on and the famine in Tigray. We really appreciate you. I would like to, ask you one question, and that is, you did speak about advocacy, and you are a big part of that as well, whether going to Clubhouse, or just making sure you're writing these articles and making sure they're going to the right people. What do you think, as diaspora, we could do better? I know we have been protesting and doing other things, but what do you think that we could do different, or do you think we just continue to do what we're doing? I would want to give you a chance to go answer that for us.
Yeah, so I think as we come to close almost, there are a couple of. So I would like to speak on this advocacy work, which is also now become closer to my heart. I was never an advocacy type person, by the way. I
No.
did my research on
Mhm.
and done academics, academic administration. That was kind of what I have been doing,
Yeah.
but this thing came. Just. And it affected me personally because my family live in Tigray, and so I don't even know their whereabouts at this point.
Mhm.
So that makes me wake up every morning and fight for them.
Mhm.
That's where it starts. You have to fight for your family first, so that you can fight for your community, and then
Definitely.
for Tigray, right? So
Yes.
that's one. Professionally, it affected me too because, as I told you earlier, I have had projects, in Ethiopia broadly, but also in Tigray,
Mhm.
with Aksum University, with Mekelle University, with the Tigray Health Research Institute, and this projects, every year that I go and spend time, doing capacity development with my community,
Mhm.
that has been stopped, interrupted because of the war. So I am also professionally affected.
Mhm.
So that means I have really pretty good reason to learn how to advocate, to
You've
learn
been
the
doing a
tools
great
of
job.
advocacy and diplomacy.
Yeah.
So I never been in Clubhouse, so I just came to Clubhouse,
Yeah.
learn it the way. I
Mhm.
never been on Twitter, I learned it Twitter, things like that. So now I think I know the ins and outs of this
Yes, you do. You definitely
this
do.
platform at this point, and
Mhm.
people kind of now know me when it comes to health topics issues. They actually invite me to help or to speak on issues. So I think, to me, as like I told you, this is 400 something days. We have done a great job as diaspora. Really, we learned the tools.
Mhm.
We picked up our slaves. We're so we are doing well now. There are a few things here and there that we need to tweak to
Mhm.
make it even go to the next level. And I don't have to necessarily say them here, but definitely, especially the professional community, there is a bigger role to play here, because most of the general public,
Mhm.
the policymakers, and things like that have heard about this actually because of all this advocacy work we do through security and justice for Tigray, and all these other Omna Tigray, Tigray use network in Europe, in the UK. You
Yeah.
have TPN, all this Wa'ala,
Hmm.
they are doing their job, right, here and there.
Hmm.
So all this effort combined has brought something, to the policymakers to learn. But there are areas where we need to still fill in, in the professional community, write more articles to go to the journals, participate in more conferences. I mean, I haven't seen any global symposium. This is the second symposium I am actually organizing at my institution.
Hmm.
I haven't seen those happening in other institutions. So, but we have so many actually professors, in so many
You
institutions
do. Yeah.
that could do and play a role here. So there are some gaps in there that need to happen, I think, to take this or to elevate this to the next level.
Mhm.
And maybe at last, there is one slide that I would like to speak on, because a way forward, we need a way forward for everything, right? And as a way forward, I would like to talk about this strategy. This is a framework actually that I originally presented in 2018 in Tigray. Uh, Maybe the technician could help us show that one slide, which happens to be my last slide.
Yeah. Yes, we will. We'll definitely go over that.
Yeah. So I would like to speak on that. Do you hear us, Wale? Here you go. Yeah. Thank you so much. Um, well, it's not coming up for some reason. You are not playing it. Here you go. Thank you so much. That is what I'm talking about. So this is, as you can see, in 2008, I was already thinking about digital Oyane. Okay.
Oh wow, you saw the future.
Yeah. So
Yeah.
this picture is from 2018, and I don't think it was used before that. Actually, it was the first time it was used,
Mhm.
and now digital Oyane is media. Digital Oyane is, the use. Everybody is using this terminology.
Yes.
Uh, the idea was, well, as a community, Tigray needs some strategic thinking. Okay, as part of this strategic thinking, we have our institutions,
Mhm.
and we have the government, we have the business community.
Yeah.
This organs, they need to be somehow connected through discovery, through institutions that promote
Mhm.
um, really thinking, that contribute knowledge
Mhm.
into the affairs of these three important institutions: the government, the NGOs, and in the business community. Okay,
Mhm.
so now, where do you get those? You have the universities, you have the research institutes, and then you have the skilled people, right?
Yeah.
What I was thinking was, for this to happen, for discovery and knowledge to come to help all these things that need to be worked out for us to move to
Mhm.
the next level, maybe middle income country, even first world country.
Yeah.
Uh, what is important is we need digitization. That was the key. So this digital Oyane, digital revolution is important. Is we have to digitize every aspect of our life.
Yes.
And recently, I have seen news from Tigray that says we are going to digitize everything. Whoa! I said
You thought about this before.
2018.
Yeah.
I was talking about this. Let's digitize everything, and it is going to help us simplify our work.
Yes.
So that is that. And maybe last, there is a quote. I think that's important for the international community as well as for ours, Wale, that you can briefly show. These are two quotes from Einstein.
Mhm.
uh, you know all this is happening, right?
Mhm.
And there are people like you, like myself, like Wale, like Gide, who
Mhm.
manages and has given us this wealth
Yes.
of Aksumite media network, fighting
Mm.
to solve a problem. And there are some who are quiet watching this, right? And
Yes.
Einstein said, the world will not be destroyed by those who do evil, but by those who watch them without doing anything. So Abiy Ahmed is doing this evil, and there
Mhm.
are some governments,
Mhm.
like organizations like the Nobel Institution, watching them, idle.
Yeah.
even she, the lady who leads that, the chairman of the committee, was on media on CNN,
Mhm.
was afraid to say,
Mhm.
to condemn, to really. I was frustrated actually, for her. She
Yeah.
couldn't say something. And the other important thing is those who have the privilege to know have the duty to act. And these are messages to people like the chairwoman of the Nobel Committee, the
Yes.
people who are presidents of countries who have influence. President Biden.
Mhm.
You know, what is going on, and I think it is your duty to act to stop the atrocities that are happening in Tigray.
Wow. These are amazing quotes that I'm so happy we're ending with those quotes, because I feel like not only do the presidents or international community need to act, but even the people next to us too. Those that know have the duty to also speak out on it. So this, I think, this goes by for everybody that knows what's going on in Tigray, and to just be the voice for the people, not just in Tigray, but everywhere else. Like, there's so much going on. So if you know what's going on, I think it is so important that you act on it and you speak on it. And I'm so happy that you are ending our um, our discussion with that. And I really enjoyed everything. And I love that we ended it with two Einstein quotes. Just I really enjoyed having you here, Dr. Mulugeta. You're a really brilliant man and has been doing so much for Tigray. And we will definitely take your advice. And I'm sure the audience here listening will take that and be more effective as well. So thank you so much.
Thank you so much, Hadash, and yeah, let's continue this conversation. Conversations bring more conversations, and that is how
Definitely.
we bring impact.
Yeah,
So
definitely.
thanks to you, thanks to the listeners, and thanks to Ahsumawan Media Network and the staff, everybody behind who made
Yes.
this possible. Yeah, thank you
Yes.
so much.
Yes, thank you, Dr. Morgeta, for coming here and speaking with us today. Thank you for the audience for staying with us. I know we've been here for almost an hour, so we really appreciate you guys and ladies staying here. Please share and subscribe to Oxymowian Media Network. And again, thank you, Professor, for being here. We're so honored to have you.
Thank you.